Hello, this is Dr. Rutledge, and I'm going to talk to you a little bit today about leg cramps. One of my patients contacted me about leg cramps. I'm going to go over some common causes, things that you might want to mention to your doctor when you go to see him or her about leg cramps. Give you some tips and pointers in general about leg cramps, but also talk specifically how the mini-gastric bypasses changes your physiology and can lead to leg cramps. And so you want to know about these things, do some things to prevent it. One of the obvious things that cause leg cramps is exercise. So if you go out and if you get in late middle age, like I am, and go out and play basketball or go running or some sport that you're not used to, your legs can hurt. And this brings up kind of a funny story. I had a patient who was part of our mailing list and was complaining of having difficulty with leg pain after his mini-gastric bypass surgery. And his wife, his trainer, and other people were commenting that his problem was low protein. And so I thought that was unusual because we don't often see low protein. It can happen. Fortunately, it's not very common. But anyways, I dropped him an email. I said, maybe we could talk and see if there is anything that might be helpful that he could take to his doctor in our discussion. So we talked a little bit, and I asked him, if he had leg pain all the time or it came on at certain times. He said, no, it came in kind of in the morning, late morning, and specifically when he was walking back home from going to the gym. I said, pardon me? He said, well, his pain in his legs hurt most when he's going home from going to the gym. And I said, well, I see. I said, have you been going to the gym prior to the mini-gastric bypass? He says, oh no, I couldn't walk even a half a block before the surgery. I said, okay, well, when was the last time you were in good health and very fit so that you could walk, and how long has that been? He says, well, kind of when I was back in the Army. And I said, when was that? And he says, it was 1960. So I said, it's been about 40 years since you were in good shape? He said, yeah. And I said, you have pain after you go to the gym? He says, yes. And I said, what do you do at the gym? He says, I walk on a treadmill. I said, it might be that your problem is you're just exercising more and that's tearing up some muscle. So always think that it could be new onset of increased amount of exercise, and that's kind of obvious. But in that case, it was helpful to point that out. And he moderated his exercise a little bit and didn't have anything to do with protein. Certainly, if that's the case, you can have a lot of pain from that. Can be severe if you do over-exercise, so be careful and cautious. And particularly our patients who can be seriously ill before their surgery, you want to look into that and not have overly high expectations for suddenly becoming a marathon runner soon after you have your mini-gastric bypass. So think about that first. The other things that are common to remind you about is the fact that there are a variety of other causes of muscle cramps that we want to talk about. On that list are several things that I want to talk about specifically. So dehydration is important. Low blood levels, particularly of some minerals, particularly calcium, magnesium, and potassium. We're going to talk a little bit about that. Rarely, low levels of certain vitamins, thiamine and pantothenic acid and pyridoxine, vitamins B1, B5, and B6 can be problems, and those can be dangerous. So I'm going to kind of talk about that first. Then we're going to talk a little bit about medicines. A variety of medicines can affect the cramping in the legs, generally because of their impact on those minerals. So we'll talk a little bit about that, but always look through your medicines as possible causes. And so if you have a medicine you're not sure about, a list of medicines might help. And because minerals are so important and vitamins are important, your diet can make a difference. And we'll talk a little bit about that. Let me talk a little bit about thiamine. Thiamine is a kind of a life and death vitamin, but it rarely causes life or death because it's so common. It's common in pasta and bread and things like that. And maybe the most spectacular, dangerous, and kind of sad version of thiamine deficiency is what's called Wernicke's encephalopathy, a brain disease where the memory is damaged. It happens rarely unless people are eating a very bizarre, an unusual diet. And so the classic example that we talk about in medical school, when we're talking with our students, is we talk about an alcoholic. And so an alcoholic may go for a long period of time drinking nothing but alcohol as a source of food and calories. And when that happens, there's not any thiamine in the alcohol. And so those patients then may suffer a lack of thiamine. And when that happens, obviously the patient then can suffer a deficiency. Not just of thiamine, but other B vitamins as well. So that's a dangerous and deadly problem. It's something that's unlikely as a cause of muscle cramps, but certainly you want to investigate your diet. If you're on a bizarre diet, unusual diet, extreme diet, something like that. If you're having nausea, diarrhea, or problems where you can't digest or absorb normal healthy foods, you want to look into that. And it's worth taking a moment and looking over the B vitamins and see that they're in the normal healthy diet of most average Americans. So I won't go into too much detail on those topics, except as a warning for patients or anyone that you might be following some extreme kind of diet where you wouldn't be having, healthy whole grains, fresh fruits and vegetables in your diet. It's possible that this rather common symptom of cramps in the legs could actually be a warning sign that your extreme, bizarre diet may be causing something that could potentially be dangerous and even deadly. So again, a warning against kind of oddball diets and straying too far from a good, healthy, normal diet, which we recommend. So I'll leave that just as a little warning there. It's unlikely that that's the cause, but certainly give it some thought and discuss it with your doctor if it's appropriate. Most importantly is just a simple warning to avoid very bizarre, unusual diets where you exclude major food groups like whole wheat, whole grain, whole pastas, things like that, where you can find easily access to thiamine. Green vegetables and fruits where you get a variety of critically important fruits and vegetables that really provide you with the minerals and vitamins that we all need to stay healthy. I'd like to talk a little bit about dehydration. Again, one of the reasons dehydration hurts and damages the muscles is you just get a lower amount of blood delivered to the muscles, and that hurts. And that's easily fixed by just maintaining adequate hydration. But you can have it, for example, in patients who work outdoors or go to extreme sports in the heat outdoors, things like that. So that's usually a simple thing to avoid. But it's important to point out that in mini-gastric bypass patients, they sustain a major diuresis. And diuresis is the big medical term for basically peeing a lot. There are hormones in the body, a system in the body, in fact, that controls fluid in the body. And morbidly obese patients have a derangement of this system where they retain extra salt and water. Against your best interest, morbidly obese patients often have high blood pressure. They can have other retention of salt and water so that you can actually see it in swelling in the ankles. You can have excess fluid in the joints with increased joint pain. You can have extra fluid in the blood vessels that causes increased blood pressure. You can see extra fluid in the lungs with pulmonary edema. You can see extra fluid in the heart with decreased cardiac function and edema. You can see extra fluid in the lungs with difficulty breathing and low oxygen and problems like that. You can have extra fluid actually in the skull and increased intracranial pressure with what's called pseudotumor cerebri. And you can have it in the lens of the eye, and it can change the vision in your eyes. And after mini-gastric bypass, in many cases, these abnormalities are resolved. That is, the extra fluid retention is reversed. The hormones that cause extra salt and water retention are reversed. And this reversal is so powerful that occasionally our patients can face significant dehydration. That is, they lose so much salt and water, their blood pressure goes down to low normal. And if they're not cautious and careful about their salt and water intake, it can become so low they become dehydrated. They can have low blood pressure. It's good in that this diuresis acts like a diuretic, like Lasix or furosemide, a medicine you may know that we use to treat peripheral edema, swelling in the ankles. We use it to treat high blood pressure. We use it to treat heart failure and fluid in the lungs, and can be an important and valuable tool. But like anything, too much of a good thing can be dangerous. So you'll want to be cautious about your blood pressure and things like that. And so again, this is something to discuss with your doctor. Simple things you can do to kind of assess in a rough way what your blood pressure and your hydration status is simply to stand up quickly. Make sure you don't do this when you're near a sharp object, or make sure you have somebody near you in case you're a little unsteady. But if you stand up quickly and you feel a little weak and dizzy, that's a pretty simple test to tell there's a possibility you might have dehydration and not be taking in enough salt and water to go along with your mini-gastric bypass. So it's a warning there to look out for that. Obviously, a simple thing you can do as well is you can get one of those wrist electronic blood pressure cuffs. Now, they're not super accurate, but if you test it when you're laying down and your blood pressure in the blood pressure cuff is normal, and when you stand up you feel a little weak and dizzy, and you re-punch the little button on your wrist blood pressure cuff and it goes down to low levels, that might be something that can help your doctor understand that when you're having these periods of weakness and tiredness going along with the muscle cramps, there's a possibility that maybe you're suffering from some dehydration, and paying attention to what you're eating and drinking might help. If you're a patient of mine, certainly these would be valuable pieces of information to return and give me, so I can help guide you in talking with your doctor about these issues. One of the things we recommend is to look at these issues very cautiously and very carefully, and pay attention to that, because we know that the surgery is very powerful in resolving high blood pressure, in resolving peripheral edema, in resolving fluid in the lungs and heart failure. So it is a powerful therapy, and like any powerful therapy, it has risks as well as benefits. So you'll want to be alert to that. And with dehydration, not only will you have some problems with weakness and tiredness, but there are other potential risks, such as you can have impaired neurologic function, so you can be sleepy and tired, things like that, which might make a difference when you're driving. So be aware of that, pay attention to that, and be careful about taking in adequate amounts of salt and fluids during the day in a regular process. So you can't, for example, skip the whole day and eat a big dinner or something like that. That's not something that will be successful after a mini-gastric bypass. If you're having some problems, that would help me by providing me what's called a food diary, telling me what you're eating and drinking. And along with that, include any supplements you're taking and any medicines you're taking, and I can look over that and give you some tips and pointers if you're doing some things that might be hurting you during that time. Another thing is the minerals we talked about. And so there's calcium, magnesium, and potassium. And again, these may be decreased because of the diuresis that occurs with the mini-gastric bypass. And they can also be decreased because the bypass itself interferes with the digestion and absorption, particularly of calcium. So we encourage increased calcium intake by the intake of yogurt, particularly because I think that's an ideal nutritional product. It has a lot of calcium, but it also has protein and probiotics. And if you look at some of the other videos on the internet, you can see why we particularly think that this combination is a good one for bypass patients, and probably for all of us. So calcium intake can be low, and again, if calcium intake is low, the serum calcium intake can be low, and if that's the case, it can be associated with cramps. So this will be one of the things you'll want to investigate by looking at your food diary, look at your diet, make sure it includes adequate amounts of calcium as dairy. We're less excited about the supplemental calcium tablets than we used to for a couple of recent studies. One is that yogurt is so good, but also oral supplemental calcium has had some questions raised. It may not be as effective as dairy calcium in replacing bone and replacing calcium in the body. Plus, there is at least one study in women where the oral calcium supplements as tablets increase the risk of heart attack. So we're favoring more that your intake of calcium should be from dairy, in particular from yogurt. We think that's a really foundational principle for good health after the mini-gastric bypass. Investigations of your magnesium level might be of value. And then, of course, potassium. Now, potassium is also lost with the diuresis after mini-gastric bypass. And again, if you're on an unusual diet where you don't include enough citrus or other potassium-containing foods and liquids and things like that, it might cause problems. And so potassium is another electrolyte that we think is critically important for people who might be suffering from low potassium. And again, this is something to investigate with your doctor and to look at your diet to make sure you're taking in adequate amounts of what we like is the citrus juices, citrus foods, things like that that can be really helpful in putting in adequate potassium back. And of course, don't forget tomatoes, tomato sauce, things like that are really good sources also of potassium. So look for those things as well. Finally, I'll finish by saying if you don't find the cause here, you might look through your medicines. And there's a lot of medicines that can potentially affect this, just like we talked about the diuretics, like the Mini-Gastric Bypass. When you lose fluid in the urine, you can cause a diuresis that loses some of these electrolytes, which can cause low levels over time. So you want to investigate any medicines your doctor may have put you on, and particularly also supplements. Sometimes supplements can have these effects and you not be aware of it. So it's something we want to talk about with your doctor or contact me. One other thing that most other physicians, as far as I'm aware of, do not know, and that is that there is a significant drop in cholesterol after mini-gastric bypass. And with the drop in cholesterol, we have seen the side effect of muscle cramps, just like we can see with the drop in cholesterol when patients are taking statin drugs like Lipitor. And again, what we found is just like in the treatment of muscle cramps with Lipitor, we have found that sometimes CoQ10 can be really helpful in that area as well. So again, that'd be something to bring up and discuss with your doctor, especially if your cholesterol, as in many of our MGB patients, is quite low, as we expect it often is. There's tremendous benefits as far as life and death with a lower cholesterol, but if it interferes with the normal functioning of the body's muscle cells, then low cholesterol can be a danger and a complication as well. So you want to investigate that with your doctor. It's nice that in those cases, usually over-the-counter CoQ10 in combination with these other effects and treatments can often take care of the muscle cramping. I hope this discussion has been a little bit useful to you. If you have any questions or concerns, please don't hesitate to discuss this in more detail with your doctor. And if you're one of my patients, don't hesitate to contact me and give me some more information, particularly with a food diary, with a listing in detail, meticulous review of your medicines and supplements and your liquid intake. It can be really helpful in diagnosing this problem and discussing it with your local doctor so you can kind of figure out what's going on. Overall, it's been a pleasure talking with you, and see you again soon.